My gums keep bleeding, they keep bleeding my gums. Good thing it's Dental Hygiene Wednesday. Hi, I'm Christina. I'm the lead hygienist here at Dublin Dental Care, and I want to welcome you to our Dental Hygiene Wednesdays. Every week we like to cover different topics or products that we feel are important for our patients and our viewers to know about. Last week we actually talked about baby teeth. We talked about when you can expect them to start popping through the tissues, and also when you can expect those adult teeth to push them out and come through. If you missed that video, feel free to check out the video on our Facebook or our YouTube page. All of our previous videos are there, so you can watch all of them if you missed them. This week we are going to talk about something that a lot of people struggle with, and that is bleeding gums and ways to keep that from occurring. So your tissues start to bleed when we're not getting the bacteria out of the tissues and keeping it from developing underneath the tissues and irritating it. So it's very important to make sure we're getting that bacteria out so you don't get the bleeding gums, or gingivitis is the actual name for that. So I'm going to show you some things that are really important in maintaining your tissue health and making sure that bleeding gums is not an issue for you. So the first thing I'm going to show you is brushing. It's key. Make sure you're doing at least twice a day. A lot of people think, I'm brushing my teeth. So a lot of people focus on just brushing the teeth, and you really need to also focus on brushing the gums, because the bristles can get down along the gum line and help get that bacteria out of there. So when you do that, you're going to angle your toothbrush at a 45-degree angle and brush down into the gums a little bit. And you're just going to go right along the mouth to make sure you're getting in along the gums, and your bristles will go down on their own. It kind of feels like a little massage. So make sure 45-degree angle, brushing down into the tissues gently. We're not scrub brushing really hard. You're just brushing it gently enough to get that bacteria out of there so they don't have a chance to irritate the tissues. Another thing that we highly recommend is a stimulant. It's a little piece of wood. We've done a video on it previously. I'll give you a quick recap. Make sure you wet the tip because it is wood. We don't want you to give yourself a splinter. But you'll put the flat part down against the tissue and the tip goes in between. So flat part down, tip in between, and you put a little bit of pressure in between where those teeth come together to help stimulate that blood flow up to the very tops of your tissues. So as soon as that bacteria gets in the area, your body's automatically fighting it off to try to get rid of it rather than having it get further along the gum line. And last but not least, something that most people, don't really enjoy doing. It does take some time, but it is very important. Flossing, it gets down under the tissue. It's probably one of the best things that does. So make sure you are flossing at least once a day. You're taking it, pulling it tight through the contact, and then you're pulling it tight against that tooth and going down under the tissue, back up, down under the tissue, back up, and then pull it towards the other tooth, down under, back up. This is making sure that if there's bacteria under the tissues, it's getting it out of there so you can keep it from irritating the tissues. Another thing that I don't have with me is a water pick. Those are great tools to use, helps rinse out the tissues. You can even add your mouth rinse to it. I wouldn't suggest filling the whole thing with mouth rinse, just dilute the mouth rinse with quite a bit of water, and that will help get rid of the bacteria and keep it from causing your tissues to be so irritated and causing you from getting gingivitis. So if you use all these tools that I've shown you today and do them every day like we recommend, you should be able to come in and get your cleaning and be gingivitis free, which is our main goal. So I hope you got some good information that you can use. We look forward to seeing you hopefully in the near future in our office. If you have any questions for me, you can email me at christina@dublindentalcareohio.com. Feel free to leave your thoughts, comments, likes on these videos. We love seeing them. And then you can also even schedule an appointment from our website. It's dublindentalcareohio.com. Have a great rest of the week and stay cool.